Health is not valued till it's taken away from us. That's what I was told by my parents when growing up. Healthcare services are an essential part of life, and tonight I will explain why healthcare should be free. Second, I will explain how the differences in income might affect your health and your ability to require healthcare. And lastly, I will explain what the healthcare services should be based on on your financial need. As the world evolves, humans become more vulnerable to disease and healthcare defects, leading to multiple healthcare problems associated with people's lifestyles, choices, and contemporary society. Sometimes these alternatives are situational, hence, making them very unavoidable. Other choices are subjective decisions of an individual, such as how they eat, what they drink, how much to exercise, and maybe even genetics. The quality and value of care are also individual based and supported by a healthcare professional. The better the healthcare, the easier it is to improve the quality of life by, by preventing diseases. World changes and lifestyle diseases elevate the demand for healthcare services. Accessibility for either private or public facilities. Due to these necessities, questions arise as to whether healthcare services should be available for free to the public. Healthcare services should be free to ensure health quality, help the vulnerable, um, fill the disparity of income, reduce the morbidity and mortality rates, and support care for costly chronic diseases. There is a significant gradient between people's well-being and their health status. The higher the income, the lower the possibility of getting diseases that sometimes lead to death. According to Wolf, it it all an individual money accrues every year, and their income correlates with their better health. People who are evalu- evaluated and found to be in low earning levels are not healthy compared to those with higher incomes. The proportionality is related to the cost of healthcare services in contemporary society. If one has a higher income, usually they can afford medical services until those unlike those whose incomes are dedicated to other basics such as paying rent, food, and other necessities. A further comparison also reveals that middle class people are healthier than and anyone whose class is near the poverty line. Similarly, these middle class individuals are not as healthy as those in the upper class. These disparities related to people's income show the necessity of making healthcare services accessible since access is tied to how much one earns. In addition to income, wealth also influences an individual's ability to afford healthcare. Low income earners in America can barely afford medical services and are often uninsured. It is impossible to pay for expensive, make co-payments, and pay for medicines if the average income is hardly sustainable. If a family has unlimited resources, they can easily live a healthy lifestyle. The same population of the wealthy class affords place-based healthcare benefits. The place-based strategy focuses on addressing all issues that make one vulnerable to diseases. It is an approach that is more than just treatment after one has become sick. Catering for psychology and health protective factors is a reservation for the wealthy in society. Unlike the less fortunate, wealthy families can have good sanitation and clean water, a place based strategy for good health. Therefore, the low income earners could be the highest beneficiaries of free health care services. Medical insurance has been used as a strategic approach to ensure citizens can afford health care in the US. More than 20 million adults had medical insurance of 2021. In medical insurance, people can use either private or public ones. The choice of medical insurance that one takes depends on their financial status. People with people with stable income opt for private medical insurance, and people with non-stable income opt for public health insurance. The question that arises from the two types of medical insurance and relates to free access to healthcare service is a level of satisfaction among the users. Private insurance does not guarantee the quality of care since their users complain of the higher costs compared to those with public insurance. It would be prudent to have a strategy that ensures all people can access healthcare services, including making it free for or giving healthcare insurance requiring users to pay very minimum cost. Some diseases require a patient to have many unlimited resources to manage. The level of care that these diseases compel patients to have a guaranteed recovery is another reason healthcare services should be free. An example of such a disease is acute kidney injury, or known as ACKI. Cholesterol et al. Cholesterol, yeah, conducted a study to establish the cost level linked to the care of ACKI patients. The subject of the study was 23 million people and hospitalized due to ACKI stages 12 and 3 without dialysis access. The assessment of cost was done after 90 days of the ACKI diagnosis. The outcome showed that severe ACKI result in a prolonged stay in the hospital. Longer stays result in a higher cost of care for the patient. The nephrologic care for ACKI diagnosis, treatment, and management rose among stage 3 patients who needed dialysis. Even through the prevalence of ACKI ranges between 1 and 66%, it is an example of diseases whose care costs the poor cannot afford. Therefore, if healthcare services were free, people would be straining less to access medical services for chronic conditions like ACKI. Free healthcare services entail removing fees in every stage of seeking assistance. The removal of these fees implies that it can trigger a significant increase in demand and everyone can access the services whether they need them. Older people, children, and women are always in need of healthcare services compared to other people. Some of the services they need are antenatal care, assisted deliveries, home care, and personal safety, which requires a fee before access. However, a free healthcare service would increase the utilization and demand for these services among people in dire need. In addition to targeting the poor, a free healthcare service would benefit mothers and children, also among the vulnerable. The benefit of free healthcare can be seen from accessing a presidential initiative from Sierra Leone in 2010. Sierra Leone introduced a free healthcare service. Sierra Leone Free Healthcare Initiative. Stop all healthcare fees for children younger than 5, pregnant women, and lactating mothers. The FHSI responded to Sierra Leone's high morbidity and mortality rates. Before introducing FHSCI, these rates in Sierra Leone affected women and children and were one of them worldwide. The primary cause of the high level of mortality and morbidity was financial constraints. The uptake of healthcare services among children under 5 and women was low because it was impossible to pay for them. However, 5 years after the introduction of FHSI, there was a significant upshot in the uptake of essential healthcare services. Therefore, vulnerable mothers and children can access medication and help reduce morbidity and mortality rates if the care is free. The provision of healthcare services should be based on three fundamental principles. The consideration when designing the policy of a program for healthcare services is convenience. It entails making the service accessible to people. Access is also about health insurance. A non-free medical service would not justify the need for medical assistance if the insured cannot access quality service whether they need it. The second principle is affordability. People should access care at a affordable cost. If the care service is unaffordable, it stops being necessary, and those affected are the majority in society. Unsustainable healthcare is linked to growth in deaths. Strain local and federal budgets to a community where citizens are always insecure. The other principle which should be essential is healthcare service provision is equity. Equality in healthcare is about making people access affordable care regardless of their origin, ethnic background, and most importantly, financial status. Conclusively, the most vulnerable in society are poor people would be the biggest beneficiaries of free healthcare service programs. The goal of these free healthcare programs is to reduce the financial burdens that hinder access to healthcare services. The approximate number of the wealthy and people with higher income in the society is much lower than the low income earners, and people living below the universal poverty line, the few wealthy individuals in society have no problem seeking the most expensive medical services globally. For the less fortunate, healthcare services, which is an essential need, are like a luxury that they cannot afford. Poor people cannot handle the high cost of healthcare services and even opt for over the counter medications. Free healthcare services minimize or remove the financial hurdles. The little income can be directed towards healthy living. Therefore, healthcare services should be free to ensure healthy quality, health to the vulnerable, fill the economic disparity, reduce the morbidity and mortality rates, and support care for the costly chronic diseases. Thank you for listening.